why is there such limited education about male health? When we talk about male reproductive health, we only think of two organs, which is the penis and testicles. Let's go to the basics, doctor. What is a prostate? What role does it play?
Most of them, if you ask, they don't know what prostate is exactly. Many of them don't know.
I would love to know more about what is TULSA-PRO.
It is real-time MRI-guided. It is a non-invasive ultrasound ablation.
One patient that made you feel extremely rewarded.
We have a patient who has a very weak heart condition. The patient was on pacemaker. He was having prostate cancer. So to undergo a major surgery is challenging in that case. So we had already TULSA-PRO with us in KIMS hospitals.
Prostate cancer surgery ends sexual life.
It depends on the...
KIMS Hospitals presents Your Health Matters podcast, where silence is replaced by science. And we learn from some of the brightest minds, reshaping how we look at our bodies, our health, and our future. Today, we dive into a topic that is going to make a lot of people uncomfortable, but is super important to address: men's sexual, reproductive, and prostate health. Joining us today is Dr. Prashanth, Senior Urologist from KIMS Hospitals, Hyderabad. He is one of India's leading voices in urological innovation and among the first in the country to introduce a breakthrough MRI-guided, minimally invasive treatment for prostate cancer, TULSA-PRO. Welcome, Dr. Prashanth. We're delighted to have you here.
Thank you very much, and I'm happy to be here.
So, as a urologist, I'm sure you've treated thousands of patients over the last 4 years. Doctor, what was that one incident on your one patient that made you feel extremely rewarded? And what was the one that made you feel extremely challenged?
Who has a very weak heart condition. The patient was on pacemaker. So he was having prostate cancer. So to undergo a major surgery is challenging in that case. So we had already TULSA-PRO with us in KIMS hospitals. In the patient, we have treated that patient with TULSA-PRO, and we have changed the pacemaker for MRI compatible battery, and we have treated successfully with TULSA-PRO, and he is happy now. He is under follow-up. That is our interesting case.
So, talking about male reproductive health system, right? When we talk about male reproductive health, we only think of two organs, which is the penis and testicles. But I'm sure that the male reproductive health system has a lot to do to it. So, my first question to you is, why is there such limited education about male health and especially the reproductive system, even among educated men themselves?
Because there's always a stigma, sexual function, education regarding to the respect to the reproductive system is there in India. Even among the educated also, there won't be any proper education regarding this, all the reproductive system details for all the group of people. And maybe to put into perspective, reproductive system includes both external and internal. We call it as external genitalia and internal genitalia. So what we are talking about the testis and penis is the external genitalia. But what we don't see is the internal genitalia, like seminal vesicle, prostate gland, ejaculatory ducts. They are connected to these organs internally.
Doctor, do you also think that when compared to women's reproductive health, information about breast health, survival health, the men's health sisters is not equally spoken about? Men don't go for as we preventive checks. Why is that the case?
Men have such stigma to go to the doctor for any kind of sexual function. They feel that they had some fault with them if they go to the doctor and say they had some problem with the sexual function. So the awareness is important. The patient should not shy away from any kind of sexual problem or reproductive health. Has to consult a urologist or an biologist. It has to be sorted out. Even coming to the prostate cancer also, that is one of the cancer of the internal genitalia. Even that awareness is also less. So overall education, patient education, general population education, health-seeking behavior is very important in these aspects.
So, Doctor, knowledge and ability watching this podcast, could you point out what are the internal and external genitalia in a man's reproductive?
Yes, I've already told. The external genitalia is what we see from outside. Those are the testis, penis. Internal genitalia are what we don't see, mainly the prostate gland, seminal vesicles, and the connecting ducts. Those we call as vas deferens. They connect from the testis to this external genitalia.
Now, you said the word prostate. I had a chance to ask my day friends if they knew what the prostate was or what it did or where it is located, and there was just vague answers, right? Oh, it's there somewhere in the body. It's a small, organ. Not sure what it does. What is a prostate? What role does it play? Where is it located? We have to know everything about.
So the prostate gland is exactly situated beneath the bladder. It surrounds the urethra. Urethra is the one which transports the urine from the bladder through the penis. The main function of the prostate gland is one is a sexual function and another is a reproductive function. When coming to the sexual function, It produces certain enzymes and certain fluid. It produces a fluid, prostatic fluid. It contains important elements like zinc, fructose, micronutrients that helps in maintaining the rate and vitality of the sperm. They produce nutrition to the sperm. It helps the sperm traverse through the vagina that neutralizes acidic vagina and also helps the overall semen to be diluted or thinned out. So that's where the sexual function of the prostate mainly comes in. May not be having a major role once the puberty is gone or once the family is complete. Other most important thing the patients tend to have or the men grow above 45 years or 50 years of age, the prostate also increases with age. And it compresses the surrounding urethra. So that's where the patient gets the low flow of the urine. They need to strain to pass urine, and sometimes the prostate gland might get infected, and that physically affects the urinary function. The patient will have other symptoms like frequency of urination, and they need to pass urine urgently, or rush to the bathroom. That are not able to hold the urination, and low flow of the urine. All those things. That is one aspect of the prostate gland that may create problem. It is severely enlarged, compressing the urethra.
So you mentioned that the prostate gland does grow age.
Yes.
Is that normal?
Yes, that is normal. Yes, that is normal. Prostate gland do grow with the age, but it depends on person to person. In some, it may grow at a slower pace, and sometimes even the smaller prostate gland also can get obstructed, can obstruct the urinary flow. It depends on how it is growing. If it is going inside into the urethra, or it's going outside, how it is growing. So we can't exactly say certain size. The patient may be having some weather symptoms. It's not like that. So it always depends on the patient to patient or person to person.
So, doctor, what are the diseases, illnesses that can affect the prostate gland?
One thing which I already mentioned, the main thing is it grows with age. In some, it may go at a lower pace, lower rate, and it might be smaller. Some it may go at a larger, faster pace, and it tend to be larger. So other major thing is the patient then have infection of the prostate gland or just the inflammation of the prostate gland. Then patient tend to have lot of other symptoms of urination, not only regarding to the flow. Patient can have urgency of the urine. Patient can have flickers of the urine. Not to hear, patient need to wake up multiple times in the night, and patient can have pain and severe fever also while there is acute infection of the prostate gland. Patient can land a severe infection, and which requires hospitalization and emergency intervention also. That is why we say that above 50 years of age, or if the patient has a family history of prostate cancer or other cancers, above 40 years of age, everyone has to undergo screening for this prostate cancer. Screening with a just simple blood test that is called prostate-specific antigen.
What are statistics of occurrence?
The prostate cancer is the second or third leading cancer in the world, and it is the fifth leading cause of death due to cancers worldwide.
What sort of group of people or what sort of group of men does prostate cancer occur in the most? Is it an age group? Is it a habit? Is it a lifestyle? Can we put some sort of grouping to what makes you more prone to prostate cancer?
As I mentioned before, most of other are non-specific. They may have some association, but strongly you can't attribute to that factor like other smoking, alcohol, or lifestyle habits. You can't directly attribute to that. The most important is the age factor. Above 50 years, there is always a rise in incidence of prostate cancer. As you already mentioned, it is the second leading cancer worldwide, even in India also, sometimes second and third, and fifth leading cause of death worldwide. So it has not to be taken so lightly, or any kind of urinary symptoms, you need to visit your doctor, get treated or completely evaluated, and you should not be waiting until the last stages.
Doctor, I think at this point, our audiences must be wondering, not just men, but even their family members must be wondering, how do I know if I am experiencing prostate cancer, right? How do I know if, I'm going through it right now? What are the signs? What are the symptoms? What is something that our audiences should look out for?
So first is the symptoms, whatever symptoms that can occur. Most of them are asymptomatic, but whatever symptoms they may experience are mostly the urinary symptoms. Patient will have a reduced urinary flow because of the obstruction secondary to the prostate gland, and patient will have to strain for urination because of the obstruction. Patient can have other irritating lux, we say, that is frequency of urination, nighttime urination frequently, not able to hold the urine, and sometimes even blood in the urine. Patient can have pain also if it is infected, or in the later stages, if it is spread beyond the prostate gland, the patient can experience pain. These are all the symptoms what the patient experience if at all. But most of the times it is asymptomatic. That's where the this PSA screening, what I was mentioning and stressing about that is very important. So above 50 years of age, every man should undergo PSA screening annually, and thereafter it depends on what's the initial base value of the PSA.
Is it right to say that the PSA fights abnormalities, but it is not always conclusive for cancer findings?
Yes, we can say. We can say like that. So it is so sensitive. Yes, it's sensitive, but not specific.
It does have to come with other tests.
Yeah, so we should correlate with other tests to find out. So even after 2 weeks also, if you don't find any other hard volume in the prostate gland, if it's just elevation, we do a routine urine examination to rule out the urinary tract infection was, because the infection is one of the major causes where the PSA is elevated. So we get the urinary test to see if there's urinary infection or not. If there's no urinary infection and no other findings suggestive of non-cancerous PSA variation, we straight away go ahead with the further evaluation diagnosis. If you feel that the PSA variation is because of the either infection or other non-cancerous reasons of the prostate, we try to treat that, and after 2 to 3 weeks we repeat. If still the PSA is elevated even after treating that, and if they have become normal, then we still suspect that the patient might be harboring the prostate cancer. So first at the initial stage or at this stage, now we are going to do further tests to diagnose the prostate cancer. The most important test in this is initially ultrasound. We may not be able to find the conclusive evidence or basic ultrasound. So MRI scan is the most important thing. So that's where there is certain scoring in the MRI report. 1, 2, 3, 4, 5. We call it as pinats. So if it is 5 scoring, high likely or highest chances that there can be cancer. 1, it is very, very less chances. So 3, 4, 5. Now we go with the further tests. So once the MRI is done and we see that PSA is elevated and there's a hard molecule and MRI there's a higher scoring, then we need to go for the biopsy. Biopsy of the prostate, we remove certain small chips through the needle from the prostate gland. That's where it is now confirmed. So directly from the tissue, we are going to remove and send for the biopsy or just a pathological examination. Now that's where the prostate cancer is confirmed. Yeah.
So, doctor, we've spoken about, getting tested and getting a confirmed result that there is, somebody is suffering with prostate cancer. What happens next? What does the prognosis look like? What does the path to recovery like?
Once it is diagnosed, we divide into stage. Not exactly stage we cancer, we divide risk criteria. Initially, whether it is localized or whether it is metastatic. Metastatic is spread to other regions of the body where it is not curable. So once it is localized, it is completely curable. And when we compare with other malignancies of the other cancers like kidney cancers, liver, lung cancers, the prognosis of the prostate cancer is very, very good. That means once it is treated, the chance of it having the recurrence or chance of it having the spread again is very, very less. So that's it. It's a good prognosis and completely treatable and curable once detected early.
What happens when you're diagnosed with prostate cancer? How is life impacted? How is your day-to-day activity impacted? And what changes, Corona?
The first thing first, once the patient is diagnosed with a prostate cancer, it takes an emotional toll on the patient. So that's just by hearing the word cancer, as I already mentioned, there are a lot of the general thinking about is that it is now end of the life. The patient may think like that. Initially, we try to find the state of the disease, and if most of the time either it is diagnosed early, and most of the time it is diagnosed also as a localized prostate cancer, which is completely curable. We first reassure the patient that here's how prostate cancer is localized. It is completely curable. We are having so many options. So first we give confidence and reassure the patient. So that's why now Lisa Elsin. Life doesn't change much just with the diagnosis of the prostate cancer, but it may change with further treatment further down the line. So there are many other treatment options like surgery and other things are there. So there might be some side effects or complications secondary to the treatment options. That's where life might change a little bit based on what treatment option the patient has undergone. But usually it's a very good prognosis, completely curable, treatable once it is diagnosed in very early stages.
When it comes to fertility or sexual function, does that also continue as the
fertility? I think the time at which it is diagnosed, that does not come much into play, fertility part. that also may not occur much. Because unlike females, where after 35 or 40 years of age, then they'll not be able to conceive. But that is not the case with the men. They can keep on producing sperm throughout life. So fertility part may not change much, and that may not be more relevant or significant at that point of time or age. Sexual function also doesn't change much. But secondly, to the treatment options what we give, like undergoing a surgery or other treatment options, the sexual function may get affected. That's where many treatment options are there. So we should choose wisely, explain all the pros and cons of all the treatment options. We should prepare the patient for that. Yes, sexual function and even urinary function also might get affected based on the treatment options what we give, and we can discuss this all in detail further down.
So, doctor, you mentioned that, there are multiple options of treatments available if, a patient has been diagnosed with prostate cancer. And I'm sure, especially with medical developments and new technology, the amount of options are, quite high. I'm very curious, what are these, options available, and how do you decide which is the best suited for a particular case or a particular patient?
Well, first thing first, coming to any kind of treatment, patient should be made aware of all kinds of treatment doctors available. Clearly be explained about what are the pros and cons of each treatment option, and we should allow patient to make the decision. That is called informed decision making. That is very important, where we gain the trust of the patient, confidence, and he will be running further complications to face. We can do in open surgery. As open surgery, you do a large incision and we go to prostate and do the surgery. That might be more cumbersome, and today's era most of them are not doing that open surgery. Others are minimal invasive. That is a laparoscopic or robotic assisted radical prostatectomy we can do. And we have other treatment options like radiation also. We can give radiation to the prostate gland, but there can be some long-term complications when we use the radiation. With respect to the urethra, the patient can experience obstructive symptoms, decreased flow of urine, post-operatively, and surrounding organs, there might be scatter of radiation can be there. And one new thing I want to share is that for the first time in India, in Southeast Asia, even in Southeast Asia, we had an advanced procedure called the minimal invasive treatment for this prostate cancer, that is TULSA-PRO. It is a trisurgical ultrasound ablation of the prostate gland to enlarge that TULSA-PRO in a short form. So that's now we are having at KIMS Hospital, Secunderabad. This have equal efficacy with the standard treatment options and minimal complications with respect to the sexual function or urinary function, and it is a daycare procedure. So these are all the treatment options, and patients who are not fit for surgery, they can have some other focal treatment options also.
So, doctor, all these treatment options that you mentioned, it's very reassuring to know that there are so many, options available, and whether you are at a low risk or a high risk, you will have something, to sort of hold on to. But there's one thing you mentioned that, particularly stood out. You said TULSA-PRO. I would like to know more about what is TULSA-PRO. You mentioned that it is minimally invasive, and you mentioned that it's for the PNW, first time in Southeast Asia from results. Could you share some more details about this?
Okay, TULSA-PRO, first to explain what TULSA-PRO is, TULSA-PRO, TULSA-PRO. It is a transversal ultrasound ablation of the prostate gland. That is TULSA-PRO. As I already told, with conventional treatment options, there are a lot of complications do happen with respect to the sexual function and urinary function also. The patient may have leakage of the urine, that is urinary incontinence after surgery. And they have to undergo through a major surgical procedure. One may not be able to recover fast and may not be fit enough also with the surgery. And other treatment options like radiation, who had a lot of side effects also. So TULSA-PRO exactly trying to reduce all these complications with minimum complications and providing good efficacy of the standard treatment options. So that's where the TULSA-PRO comes in. It is a non-invasive ultrasound ablation. It is real-time MRI-guided. Basically, with the ultrasound energy, we are going to heat the tissue to a certain temperature like 60 degrees and above. At that temperature, we are going to kill the prostatic cancer lesion within the prostate gland. So using ultrasound energy, through a probe, we are going to insert from the urethra near the prostate gland. We are going to insert the probe. From there, the ultrasound energy is delivered while the probe undergoes a rotational movement. throughout the prostate gland. It can be delivered with real-time MRI imaging, and in the real time we can monitor the temperature also. That is called real-time thumb dosimetry. It is so precisely controlled that within the margins we are going to mark for the energy delivery. Within the margins itself, it is going to deliver the energy, and we are going to precisely mark the margins with real data MRI imaging to prevent any other spread or energy spread or heat transfer to the nearby structures like important structure what I had been mentioning before. That is nerves and blood vessels for the sexual function, or this uterus enter the muscle to prevent the urinary incontinence post-surgery. So this is so precisely controlled. So that's how the TULSA-PRO, one of the major advances in the treatment option for the prostate cancer, with a good efficiency, efficacy, and with minimal complications.
That's extremely interesting to know, doctor. This begs the question: in which cases do you find TULSA-PRO a favorable, treatment option, and what does the recovery look like after, undergoing TULSA-PRO? What happens?
So, I mentioned before that we are going to divide the localized prostate cancer. First of all, we are going to use this for only localized prostate cancer. We are going to treat, and that in the localized prostate cancer also, low and intermediate we are going to treat this. So, low and intermediate are the most favorable factors or eligible, those candidates or those patients are eligible for this TULSA-PRO treatment option.
And what happens after the TULSA-PRO? What does recovery look like? And what does, lifestyle look like? Any changes that a patient should prepare?
I want to mention few advantages of TULSA-PRO other than whatever the complications I was mentioning. So first of all, important is that sexual function. The erection most operative is maintained as it was before the procedure. Secondly, this patient is not going to have any leakage of the urine, like that may happen with other surgical options or radiation therapy. And there is no bleeding whatsoever. Scarless, there is no scar. We are about to introduce to the natural urethral opening. And patient can be discharged on the same way itself within 24 hours. So he can return back to his daily activities on the next day itself. So that's where it is not going to affect his daily activity. And it's only one sitting. Unlike the radiation therapy where they are going to give multiple settings. And surgery, patient need to had to without patient need to stay in the hospital for 3 to 4 days. And post-operatively, you need to take some rest. We cannot carry on with the daytime duties. Once he's completely fit, he can carry out. So that's not there with this TULSA-PRO. That's a major advantage with this TULSA-PRO.
Understood. This is very fascinating to learn about, doctor. It makes me wonder, how did such a technology come around? What's the history of TULSA-PRO, and what are the sort of tests, that were undergone to arrive at this technology?
Yeah. So the use of ultrasound energy for the treatment options is always there, even before the TULSA-PRO also. Even for the prostate also, other kind of ultrasound energy label is there. What we call as HIFU. HIFU means high intensity focused ultrasound.
Doctor, you mentioned the word AI. You mentioned that it's robotic and AI intervention or, involved in the TULSA-PRO procedure. Can you throw some more light on where does artificial intelligence come to the picture and the robotic aspect as well?
Yes. The dominant aspect is whatever probe we are going to use. That is called transelectral probe. The probe has multiple beads, like 10 beads. They deliver the ultrasound energy. So that probe we are going to introduce from the urethra into the prostatic gland. So that we are going to introduce, and that probe is, we are going to attach the probe to the robotic arm. The robotic arm going to deliver that, rotate that probe. Meanwhile, that is delivering the ultrasound energy. Whole this is being done with the TULSA software, and that is AI integrated. So it automatically, there is a live feedback of the energy and within the margins whether the energy is getting delivered or not. With the light feedback, automatically the robotic arm adjusts its speed and energy delivery. So that is where AI assists us, and also AI is also important in marking the margins. The prostate gland anatomy is very much different at different levels. Every patient has different anatomy. Even if the patient also different levels, it is irregular. So it is difficult to deliver the precisely with that margins. So we are going to draw the margins around the prostate gland at all levels, and AI also in drawing that margins accurately and precise, close to a control, precisely the energy is delivered within the margins itself. All this is automatically adjusted. Even if there is some energy is getting outside the margins, the rate will be adjusted. Energy delivery will be adjusted, and the speed of rotation will be adjusted automatically once we start that procedure.
After they have chosen that they'd like to go upon the TULSA-PRO treatment, what does the timeline look like? How soon can they, begin the treatment? What does that period look like?
As soon as it is diagnosed, we can go with the treatment of TULSA-PRO. Unlike surgery after biopsy, they need to wait for 4 to 6 weeks. TULSA-PRO, we may not wait for so long. 2 weeks time would be sufficient. We can go ahead with TULSA-PRO.
You mentioned fitness. So, is there any preparation that a patient needs to undergo? Any sort of tests or evaluations, medical evaluations that between selecting the procedure and actually going through the procedure? Anything that they need to take care of that period?
So we are going to diagnose. Before that, only MRI is already been done. Biopsy tissue diagnosis we are having. One thing, we are going to do a PET scan, PSA PET scan to rule out any further spread elsewhere. And once it is localized, we are going to fit the patient into glomerular risk criteria. Then, for the fitness, I will to say the fitness of this procedure or fitness for anesthesia. For that, they need to undergo for a variety of tests. That will be checked by the anesthetist, and they will see everything is good and patient is ready or fit to undergo this anesthesia and for the procedure. That is what I'm speaking about.
Any sort of post-op care or meditation that's required?
Yes, they will require. We are going to put a catheter after this procedure, inward catheter. That's going to stay in the patient for 2 weeks. After that, we are going to give general antibiotics and other medications because of the catheter base. And that's it, not any other thing specific.
So, doctor, this treatment, is it performed in like a, in an operating theater, or do you, do it in an MRI suit, and what's the reason behind it?
We were question to ask. Definitely, we are going to do this in MR room itself, unlike in operation theater, the other procedures. Because here we are going to take a real-time MRI imaging. This is one thing. So, we are going to dictate on the current imaging, unlike the past imaging, in which we depend on. So, real-time imaging, we need to know the prostate cancer lesion in the prostate gland. That is for one thing. Other thing is the real-time thermal dosimetry is there. While this TULSA-PRO is delivering the energy, in the real time, we can monitor the temperature within the prostate gland. We require the temperature to be around 60 degrees for the prostate cancer cells to be killed. So that's where the energy delivery is precisely controlled with the automatic feedback loop with the robotic arm and artificial intelligence integrated. So that's why we require this procedure to be done in the real-time MRI. And after the procedure also, we are going to take another MRI scan, contrast enhanced MRI scan, to know the adequacy of the ablation. So that is we all together. This is the MR-centered puppet altogether. Yes.
Doctor, of all the cases in which you have used TULSA-PRO as a therapy, is there one that stands up for probably all of the first few ones that you've done, or somewhere you saw some incredible results, something that you can share with us?
Yeah, first one is always special, but it's a routine care. But one level case I can get back to is that one prostate cancer patient, very elderly patient, is a cardiac patient. So he has undergone stenting for his cardiac issues and he needs to be on anticoagulants, means a blood thinners. Patient needs to be on blood thinners, and it is usually with other surgeries and other procedures, the anticoagulants, we are going to stop the anticoagulants few days before the surgery, and they'll be always at risk of getting another heart attack or myocardial infarction, that is MI, during the procedure or after the procedure, also post-operative. They would always have a chance of this failure, heart failure or decompensation. The benefit with this TULSA-PRO is that in this patient, we did not stop those things because there is no bleeding with this procedure. In this patient, without any doubt or without any hesitancy, we went ahead after explaining that we did not stop this procedure. Of course, you are taking cardiology PRS. In that patient, this felt very smooth recovery. Even that patient also got discharged on the same day itself. And he even very happily that he did not have to stop and go through that risk and that thing. So that is one rural case I can recall. Of course, not the first case, but as a good case to do as initial cases.
Doctor, I'm sure, like you said, this is come around 2019. So I'm sure before that, there must have been cases where you might have felt the need for such a treatment, where you must have thought, if such a treatment had existed before 2019, a particular patient would have, benefited from this. Do you remember any such?
What I can remember is mainly of the many patients that come to us. They're always concerned about this sexual function And even if not for the sexual function, they don't want any kind of urinary leak after the surgery because he has come without any symptoms, got diagnosed of prostate cancer. Then after the prostate surgery, patient is leaking and wearing diapers. Patient is smelling around the house and is not going to walk away or go to other social cases. So that hinders the patient and decrease the body of price. So one patient came to us. Of course, the surgery was done outside at other sector and came to us with a leakage of the urine after prostate surgery. So in the patient, I thought that he would have better treated with the this TULSA-PRO where we can preserve that urethral sphincter and patient might not have had any incontinence if he had gone through this procedure.
So talking about prevention, what is a checklist, you would like to suggest to every man watching this that he should take care of, to make sure that he's not suffering with any prostate issue or prostate cancer?
The most important thing the MEC should have a checklist about their prostate health after they are in the prostate cancer is that patient should have a track of his any changes in the urination, any changes in the sexual function has to be taken care of. And third important thing is the PSA screening. In men above 50 years of age or with 45 years of age with a family history. Patient should be aware of the family history, whether family history of cancer is there or not. Other would be men, we encourage the men to adopt the healthy lifestyle and avoid addictive habit.
I'm sure this checklist is going to be very helpful for our watchers and they're going to have something to sort of, take back from this video as well, doctor. As we're nearing the end of this conversation, we actually, collected some common myths or common thoughts that men have, regarding prostate cancer. I'm quickly going to leave them on and would love to see your reaction to these statements, yeah? The first one is only old men get prostate cancer.
No, definitely not. Even younger men, the family history can also have a prostate cancer.
The second one is I have more pain, so I'm fine.
It's not like that. Even a symptomatic patient can harbor the prostate cancer, and most of the prostate cancers are asymptomatic. So it's not the case that if a patient is asymptomatic, he might not be having cancer.
The third one is frequent sex is what causes prostate cancer.
Definitely not. Be encourage a healthy, active sexual life always at all the time as far as possible. In fact, the interesting fact is a very one study with the frequent sex or frequent ejaculations, the patient tend to have a less incidence of prostate cancer also. There are two studies stating that. So we encourage the patients to have a active, healthy sexual life.
Interesting. The fourth one, doctor, all prostate issues are cancer.
Most of the prostate issues are secondary to the enlargement of the prostate. Only 30% of it or less than 20% may be a prostate cancers.
Understood. Fifth one, prostate cancer surgery ends sexual lives.
Not always. It depends on the lesion of the prostate cancer within the prostate gland, its location and stage, or depends on that. Just the prostate surgery may not be unrelated to the sexual life with the advent of the robotic technologies and even in the surgeries. Even the prostate surgery is possible without any other sexual complication for us.
Last one, doctor, is super interesting. It says, hospitals are biased towards profit. I do that, I'm fine.
It is not like that. We can't say this as a blanket statement, and it's probably like this also. Usually, most of the hospitals work for the better of the patients, but we should know that everything comes at a price. So, to avail the best technology and the best treatment options, you may need to spend, or it may be expensive, but always at the cost of the patient safety and outcome is important at the end.
It's interesting to see, doctor, the sort of thoughts that, men and their families have about what prostate cancer means or what prostate cancer can look like. But thanks to professionals like you, we have these myths broken, we have the truth easily accessible and easily understandable. I think a big factor for this misinformation is stigma, is taboo. Unfortunately, prostate cancer sits at the intersection of two big taboos in our society. One is, male reproductive health and male sexual health, and the second, of course, is cancer, all the big C word. So, what do you think is the reason behind, let's say, this prostate cancer being such a taboo topic, not having enough information, not having enough education about it? Why do you think this is happening and how can we change it?
Yes, definitely. There's always a taboo with the sexual health, be it female or even male. For so more with the male because they always equate this with the masculinity. When they come out or express some disturbance in the sexual function or some problem in the sexual function, They always think about what do peers think, what do even the doctor think, and even they're ashamed to see a doctor also, and what does the spouse think, and they're not free to speak these things even with the spouses also most of the times. They're not going to express this in the peer for. Well, that's where this taboo comes in. But the sexual health is very, very important for the overall health and for the relationship and all those things. Men should be aware that everyone should take care of their sexual health, should be openly, freely able to discuss, at least with the doctors. They need to attend, they need to take counselings. General education is very important. Even the education of the parents, education of the spouses, and even try to incorporate this sexual and reproductive right from the childhood, teaching them not like a taboo or other thing, teaching as a standard subject is very, very important. So that's where we can cross these boundaries and break the stigmas and taboos, and create a good, healthy reproductive environment for the both male and females.
So, Doctor, what could your final message be? What's the one takeaway you want for our audiences to have?
And the final and important takeaway points which I like to mention is that please don't ignore any of your urinary or sexual symptoms. Please go and meet your doctor, urologist, or andrologist. Screening saves lives. PSA testing is very important. With early diagnosis, there is complete and adequate, and treatment is always there. Don't shy away from seeing your doctor. Family awareness is also very important. Adopt a healthy lifestyle.
Thank you so much, Doctor, for having this conversation. You have brought clarity, honesty, and compassion to such a taboo topic, and you've spoken about it so freely that I'm sure it encourages all of our viewers as well to look after themselves and take care of themselves better. Thank you so much for making the time to talk to us.
Thank you. Thank you very much. Hope this discussion will bring a lot of awareness in the general public and patients. Thank you.